Welcome. The following is a brief video of the UNC Orthopedic Physical Therapy Residency Program's clinical sites. The UNC Orthopedic Physical Therapy Residency is a collaborative effort between the UNC at Chapel Hill's Division of Physical Therapy academic program and UNC Hospital's Rehabilitation Services Department. This is a mutual effort combining decades of academic work, research, and clinical excellence. More information about our program can be found by going to the UNC Orthopedic Physical Therapy Residency website or reviewing the Directory of Programs with the American Board of Physical Therapy Residencies and Fellowships, or ABPT-RFE, and you'll find the UNC Orthopedic Physical Therapy Residency information right there on the ABPT-RFE website. Or you can reach out to us directly. We'd be glad to communicate with you and help you in your journey to find the next best step for you in your professional development.
Hi everyone, my name is Bria Dunn. In addition to graduating from UNC's Physical Therapy School in 2018, I recently completed the Orthopedic Physical Therapy Residency Program in 2020. The residency is a one-year program that you can complete after you've graduated from physical therapy school, where you get special knowledge in a specific patient population, in my case, orthopedics. UNC also offers residency programs in neurologic conditions as well as pediatrics. The residency for me gave me advanced knowledge as well as advanced skills to treat patients more effectively and efficiently, reducing their pain and getting back to what they love to do quicker than ever. The residency, while very challenging, was a very rewarding opportunity to work with experts in the areas of shoulder pain, neck pain, back pain, foot and ankle injuries, hip pain, knee injuries, you name it. We talked about it in the residency. After the residency, I felt that I was more competitive when it came to applying for tough jobs or jobs that a lot of people were applying to. For that reason, I definitely recommend that you consider a residency program in physical therapy. Other options may include sports, cardiopulmonary, women's health, just to name a few.
On our residency fact sheet, which you can access from the UNC Orthopedic Physical Therapy Residency website, you'll find the framework of our weekly schedule. 30 hours in the clinic per week. Monday, Wednesday, Thursday afternoon, and Friday are the clinic work days. Thursday morning is a mentoring time, so you're in the clinic on Thursday mornings, but you're with your mentor, typically 4 hours per week throughout the majority of the residency. And then Tuesdays are for residency work, and that may include didactic work, lab work, observation time, and so on. Before the clinic tour, let's take a minute to hear from another of our residency graduates.
I did the UNC Orthopedic Residency Program to get the best possible outcomes for my patients and feel confident walking into the treatment room. Following the residency, I was able to get my dream job with UNC, thanks in part to my education at UNC. I feel confident in my examination and treatment skills as I have the clinical reasoning skills and the most up-to-date research to support me. Without the residency program, I wouldn't feel as confident.
Let's talk for a moment about the time you would spend in the clinic within the UNC Physical Therapy Residency. We do have 2 clinics on each side of the residency at the University Physical Therapy clinics, one in Hillsborough, one in Durham, and then we have 2 clinics located at the UNC Ambulatory Care Center. So the hospital clinics being over here at the ACC, and the university clinics being here, one in Hillsborough, one in Durham. And I encourage you to go to Google Maps and look at those locations. They're all within about a 20-minute driving distance from each other, all pretty close to our home base in Chapel Hill. It is a program here at UNC that is planned for 4 residents a year, cohort running from August to August, approximately 53 weeks of work. Each resident will work in 2 of the 4 clinics over their 12 months, so 6 months at each clinic, 1 university and 1 on the hospital side. So just so you're aware of the labeling here, UPT, UNCH, UNC Therapy Services, ACC, you can see that just so you understand all of the acronyms and lettering. First half is in blue, second half in red here for our sample schedule. So we see the university clinics here in the green columns, Hillsborough and Durham, and then the two ambulatory care clinics with physical therapy, two separate clinics but within the same building. So if we look at our first resident going across, they may spend their first 6 months of residency, so that would be August to February, at the University Clinic in Hillsborough, and then they would switch over to the hospital side starting March and spend 6 months at the UNC Therapy Services Clinic at the ACC. Second resident, you see they'd start at University side in Durham and they'd finish at the hospital side ACC, and so on. So we go to the third residents starting at the ACC hospital and finishing up at University side in Durham, and then the final residents starting at UNC Therapy Services Ambulatory Care Clinic and finishing up at UPT Hillsborough. Let's go ahead and take a tour of those clinics. Well, that about wraps up our clinic tour and give you a little bit of a look in the day in the life of a UNC at Chapel Hill orthopedic physical therapy resident. If you have more questions or seek more information, certainly invite you to go to our website or to reach out to one of us via email. Perhaps we can do a phone call or a Zoom, or maybe even one day meet in person. Again, thank you so much for joining us and for thinking of UNC as an option for continuing your professional education and development. Wish you a great day.